everyone. My name is Leah Stevenson. Today we'll be presenting on Erikson's stages of development, and we're going to be covering toddlerhood, which covers the ages from 0 to about 2. And we are going to be presenting with Angie, Ryan, Victoria, Zaria, Kayla, and Naya, Isabella, and myself. And I will pass it off to Victoria to have her introduce our first slide.
Hi, I'm Victoria. The first slide is called at the developmental stage, toddlerhood, birth to 18 months. From birth to 18 months, Erikson described the main development stage as trust versus mistrust, which is considered one of the most important stages. During this stage, babies depend completely on caregivers for food, comfort, safety, and love. Because of this, it is important for caregivers to learn the different needs which help the baby trust the person who's taking care of them. I'm going to pass the mic to Millie.
From about 18 months to 3 years, Erikson describes this stage as autonomy versus shame and doubt. During this stage, toddlers want to do more things on their own and begin making simple choices, such as which cup they want to use or what clothes they want to wear. They are learning independence little by little, and this grows through practice, patience, and positive reinforcement. Toddlers also often say no and begin testing limits as part of their learning control and independence. In many ways, they are just trying to see how much control they have and how far they can go. During this stage, encouragement from caregivers is very important because it helps build confidence and autonomy. Toddlers also begin to understand feelings more gradually and may start showing stronger emotions such as anger, sadness, excitement, and frustration. They may also become upset more easily when they struggle to communicate those feelings. Caregiver guidance during this time is very important because it helps toddlers learn how to express themselves and interact with others in a healthy way. It is also important to know that toddler training may also begin during this stage, which is another sign of growth and an important part of developing independence. Next, I'm gonna pass it to Rai.
All right. So, what makes the toddler stage, different? So the first 3 years of life are very important for brain development, social, emotional, and cognitive skills. As it relates to Erickson's stage, trust and mistrust, infants are relying on the consistency of the caregiver to build trust. This is considered a sensitive period for infants because their emotional well-being is dependent on maternal well-being and that mother-child attachment. During the toddler stage, children are rapidly growing. As it relates to Erickson's stage, autonomy versus shame and doubt, children start expressing their independence with increasing confidence. They go from crawling, standing, walking, running, and climb pretty fast, and they learn through movement and hands on experiences. Language development expands during this period, moving from single words to short phrases. Repeated experiences, routines, and interactions help strengthen cognitive development that supports learning. Positive relationships and predictable environments are the foundation for confidence, trust, and lifelong development. Adversely, when a child lacks positive social, emotional, cognitive, and physical development and trust from their caregiver, their growth can be stunted or delayed. They also can display problems with attention, focus, learning disabilities, low self esteem, impaired social skills, and trouble sleeping. And next, I'm going to pass it to Zaria.
So I'm on the methods of communication. So some common barriers to communication. So you would start medical counseling at 2 years of age, primarily when you begin the pre-operational phase. Any health counseling given to a toddler would be during this phase. Anytime before this, the toddler would not be able to comprehend anything, and counseling is not recommended. Children in this age frame are unable to process any medical information given to them. They are unable to understand how their actions can impact their health, and they have no concept of cause and effect. So, when you're communicating with a child of this age, use a combination of verbal and nonverbal communication to create a sense of safety to the child. So, for verbal communication, most children in this age range, they enjoy having someone talk with them. So when you're talking to this child, you would talk to them in a calm, pleasant voice to help soothe them. For nonverbal communication, have a relaxed body posture, smile, use appropriate eye contact and gesture with your hands. When used correctly, both can convey this sense of safety to the child. You need to adapt your communication to the developmental of the child. So, for instance, if you're giving a medication to them, you're going to be like, Mom, your daddy is going to give you this medication at bedtime. It's going to help you feel better. You're going to involve the caregivers. Most of your information with the medical treatment is going to be to them. So now I'm going to move it on to Anne.
Okay. I'm going to talk about health promotion issues for 0 to 18 months, or 12 months, excuse me. And the first one I identified was sudden infant death syndrome. The babies that sleep on their backs are much less likely to die from SIDS than babies who sleep on their sides or on their stomachs. Many parents have the emotional pull of having the baby in bed with them, or giving them blankets, big pillows, stuffed animals, that sorts of thing, and bumper guards on the cribs. And they shouldn't do any of that. Baby needs to have just swaddling jammies and let them sleep on their back. It's much safer for them that way than to have them on their back, on their stomach or on their side. The second one I identified was car seat safety. According to the National Highway Traffic Safety Administration, lower socioeconomic status contributes to the improper use of car seats. And part of the reason that is parents in that economic status have limited financial resources. They tend to have lower education levels and reduced access to safety education. So it's simply a case of they don't have the money, they don't have the education. Oversimplification, but that's one of the root causes of the problem. This motor development. Good nutrition and proper sleep, along with adequate medical care, are important for healthy motor and brain development, especially at this age. And again, lower socioeconomic status impacts this because parents that don't have the financial resources to provide those things for their babies don't have the best food for them. Babies might not be getting proper sleep because of that. And again, adequate medical care is something that they lack because of the financial resource. Now I'm going to turn it over to Leah for the rest of that slide.
All right, thank you, Anne. So after that 12 months leading up into the 2-year mark, we have lead poisoning, injury, and excessive screen time as health promotion issues. With lead poisoning, we know toddlers are at an extremely high risk. They're mobile now, they're exploring the world, and they're on the floor a lot. They love to put things in their mouth. All these things we know about toddlers. Lead causes permanent brain damage, development delays, and we know in the United States there's estimated 535,000 U.S. children between these ages that have elevated blood levels. With injury, like I said, they're just learning to be mobile. They're learning how to balance themselves, but they don't quite yet have the knowledge of what things are and are not safe. We know drowning causes more deaths than car injuries in the United States. So going back to what Anne said, car seat safety, so important, especially with this age group. And then we also have excessive screen time. Excessive screen time is linked to so many different negative health effects. Speech delays, shortened attention span, sleep issues, lack of physical activity. And we know half of toddlers between 2 and 4 are using double the limit for the CDC. So all things that are health promotion issues, stuff that is good to address with parents to ensure our toddlers aren't experiencing these negative health effects. And I'm going to pass it off to Kayla for our next slide.
Okay, so I did a slide about safety and injury prevention. So starting from birth to 18 months, safety mainly focuses on protection since they are not very mobile yet. We want to make sure infants are always sleeping on their back on a firm surface, with no extra items in the bed to reduce the risk of suffocation. They should never be left unattended and small objects should be kept out of the reach to prevent choking. It is also important to check bottle and bath water temperature to avoid burns. For younger toddlers, safety changes because they are more active and curious. They require close supervision since they can walk and explore their environment. We should childproof the home by using locks and gates, securing furniture to prevent tipping, and keep medications and chemicals locked away to prevent injury. For both infants and toddlers, proper car seat use is very important. Children should stay in rear-facing car seats as long as possible because it provides the best protection for their head, neck, and spine. Car crashes are a leading cause of injury in children, but proper car seat use helps prevent this. In fact, about 325 children under the age of 5 are saved each year by car seats. And then I'm going to pass it off to Naya. Touch on the importance of nutrition at these ages. During the first 18 months of life, nutrition is super essential for just proper growth of the child, brain development, and immune function. One of the most debated topics is choosing between breast milk versus formula, and um, breast milk is considered to be the best source just due to its ability to provide the antibodies for the child, in addition to just kind of adapt to their general needs over time. Uh, but however, formula is also a safe and effective option to provide the same necessary nutrients for healthy development. And one important factor to point out is that bonding is not dependent on the type of feeding that the parent chooses. Um, Both offer um, strong attachment through skin to skin contact, eye contact, and just overall response to cues that the infant may give. Um, And as nurses, it's super important for us to support the parents in whatever choice they decide to go with, whether it be formula versus breast milk. Um, Also, another important factor in nutrition is being able to pick up on both nonverbal and verbal cues, in addition to kind of creating a routine through those. Early cues for ages from birth to 18 months can include putting their hands in their mouths, lip smacking, and these are typically considered the best times to feed before you get to late cues that include crying and just an overall upset demeanor, which means, the baby is extremely hungry. Um, in older infants from like 18 months to 2 years, typically they'll use small word phrases that might contain like eat, or they'll point to the food to communicate to the parent that they're ready to eat. And they also may show like behavior changes similar to infants, where they'll present as irritable or may throw tantrums, and that is considered late signs for their hunger. Um, Above in this slide, I have kind of included like a small chart just to kind of give an example of like a feeding schedule. And next, I want to touch on solid food, like in the introduction of solid foods versus like proper weight gain. Solid foods are typically introduced around 6 months when the child shows like signs of being ready for that, which can include just ability to hold their head up and just an overall interest in foods. Typically, the first things that are introduced are like fruits, vegetables, seeds, and these are typically like ground up into a softer material so that you can prevent anything like aspiration. Um, and as far as healthy weight, typically from birth to 18 months, infants will double their birth weight within the first 6 months, and then by 12 months, they are just about triple their birth weight. And then with toddlers ages 18 months to 2 years, they should already be eating solid foods at this time, transitioning to like trying different varieties of foods. Healthy weight gain for um, toddlers at this age is typically about 4 to 6 pounds a year, and just should parents should continue to monitor their growth. Um, and at this age, they're also developing, like we discussed earlier, their gross motor skills, like, walking and being able to climb things and sit independently, sit at a table. And in addition to their fine motor skills, like using their fingers and holding the spoon and holding bottles, which helps promote their independence to feed themselves. It's super important to do this because it promotes the autonomy that Erikson super focused on during this age group. And then a good consideration, like with environmental factors, can include like limiting distractions like TVs, tablets, phones, just anything that can make it harder for them to focus on eating because it can lead to them not being able to tell when they're full because they're back and forth to the table. And then also eating together as a family can also help encourage like healthy eating habits and routines and kind of create that routine for them. I am now going to pass it on to Bella.
So on this slide, I will be reviewing the topic on infection prevention. This is definitely a critical point to educate our parents with their newborns and 18 months to 2 years because the pediatric patient is more at risk for infection. So during these ages from birth to 18 months, it is important to educate the parent to practice hand hygiene very frequently. We also, around this age, expect for the parents to advocate for other people like family members and people that want to come and visit the patient to wash their hands and practice hand hygiene to prevent risk for infection. This ensures that no pathogens are left on the areas or items that can be contributed by to the infant. The infant is very vulnerable at this state because their immune system is super underdeveloped. Proper immunizations can help prevent the infant from obtaining infectious diseases like hepatitis B or RSV. Vaccination is one of the best ways parents can protect infants, children, and teens from 16 potentially harmful diseases. This is important to ensure that the baby doesn't get sick and lead to chronic illnesses that can even develop long-term chronic issues. Cleaning and disinfecting areas to maintain clean environment and proper bottle cleaning is super important for the birth to 18 months, and then avoiding people who are sick. During the ages of 18 to 2 years old, disinfecting toys and items is a super big one because, babies drop things and then they put it back in their mouth, and we want to make sure that no germs or any pathogens can be transmitted to the patient. The toddler will learn to blow their nose and brush their teeth, so the parent will need to teach the baby or toddler to do basic hygiene practices, and then continuing and following vaccinations and boosters, and ensuring up-to-date vaccinations is super important in infection prevention. So yeah, all of these things are really good education points to talk to and tell our parents.